monitor, the #1 health show. If inspiring you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
You're welcome back once again to Health Monitor, your guide to good health, and this is the body care part of the show. And on this part today, we're looking at hepatitis. Okay, there's hepatitis A, B, C, D, and E. All right, and these are conditions that are treatable and also preventable. All right, so I have somebody here in the house, pharmacist Bola Sharmeko of Bola Naturals, Bola Pharmaceuticals. Okay, he is a seasoned pharmacist and also into natural herbs. And while we're offset, he was telling me so many beautiful things about natural herbs. You're welcome once again to Body Care on Health Monitor.
Thank you very much.
Okay, World Hepatitis Day. Why was a day set aside for hepatitis?
Hepatitis is very, very important. As you know, it's the habit of World Health Organization to set out special days for certain disease conditions, certain health issues. Worldwide, you've got World Cancer Day, you've got Diabetes Day, you've got Sickle Cell Day, you've got Malaria Day. So in the same way, hepatitis happens to be a very, very important subject matter. So that's why they set aside July every year. Specifically this year is July 28th as World Hepatitis Day. The purpose is awareness.
So you want to tell us what is hepatitis? And there's A, B, C, D, and E. And you want to draw attention on the one that you want us to know about.
Yes, hepatitis is an infection caused by a virus.
Okay.
You know, there's a difference between a virus and a bacteria. So, infection caused by hepatitis virus is hepatitis.
Okay.
There are 5 types of hepatitis virus that have been discovered. A, B, C, D, and E. They are given the letters A, B, C, D, and E. Now, worldwide, the most common are B and C. Basically, A and E will show up and die off by itself. They don't go on to cause any long-term disease. D is less common. Now, where we have B and C, in the United States of America, for example, hepatitis C is more common than the B.
But it's not really that dangerous, as you said.
Oh, it is dangerous.
It is?
Yes, it's as dangerous as the B.
Okay.
In Africa, hepatitis B, in sub-Saharan Africa, hepatitis B is the most common. They're all variants of the same virus. Now, incidence of hepatitis worldwide is about 10 to 20% of the population, worldwide population. In Africa, it is in Nigeria specifically, it's over 30%. That means there are about 30%, more than 30% Nigerians that are carriers of hepatitis. In other words, there are reservoirs that can now begin to infect other people. More than 7 to 10% of them will go on to be chronic, what we call chronic carriers. In other words, they carry it for life. And those ones are more dangerous in terms of the fact that their reservoirs and cause more infection. It is the word hyperendemic is used for situations whereby the carrier rate over 7%. So there's hyperendemicity in Nigeria, for example. From hepatitis infection, about 1 million Nigerians will go on to die from liver cirrhosis, liver cancer, and other complications of the liver. Believe me when I tell you that hepatitis is a bigger problem than HIV. It surprises people when I say, but it is a bigger problem.
But there's more attention on HIV and AIDS than hepatitis.
There's more attention. Unfortunately, well, I won't say unfortunately because HIV people too need attention, but there are more people infected with hepatitis.
And which is more dangerous?
The disease is more insidious.
Okay, when you say insidious, let my...
There are a lot of carriers that do not know they are carrying it.
Okay.
And also, the prevention and the knowledge about hepatitis is not as much as HIV. So a lot of money has been poured into HIV over the years. And money usually makes a difference in some diseases in terms of being available for research and for drugs and for prevention and for vaccines and so on and so forth. Okay. But generally, recently, hepatitis is beginning to get more attention. I also say it's more insidious in the sense that you can carry hepatitis without knowing unless you go for a blood test. And then you may not feel sick or anything. In acute cases here, you feel sick, you have the symptoms very similar to malaria or typhoid. But you may not know it's hepatitis unless you test for it. And there can be a chronic carrier, which means that you may live without knowing it, and then after a while, the person can come down with also liver complications and diseases.
So it affects the liver.
It affects the liver.
Okay, so what are the symptoms so that people can know if they have it?
Like I said, very similar to malaria. Body aches, pain. In some cases, you could have a swollen liver, sickness, pains in the joints, general malaise, weakness, tiredness, fatigue.
These are the symptoms of malaria.
Very similar, yes.
So that means when you feel this way, don't assume it is malaria and go take malaria medication. You should do a blood test.
You should do a blood test.
Okay. So
what we said last year during the Hepatitis Day was that, do you have the symptoms? 1, 2, 3, 4. Have you checked for malaria? Is it no? Have you checked for typhoid? Is it no? Then go and check for hepatitis. And that's the advice I'll give people.
Okay, so can we take a shot at the causes of hepatitis? B or C?
The causes are basically being infected from somebody that is a carrier.
Okay, so how do you get infected?
What
are the ways that people can get infected so that they can avoid it?
By exchange of body fluids.
Exchange of body fluids. Okay.
Usually or from mother to child.
Okay. Pregnant women should also test so they don't transfer it to the baby?
Well, if you are pregnant and you're a carrier, you need to vaccinate the baby. Vaccines are available.
The unborn baby?
No, after you. Of course, after you've had the baby.
Okay.
There's vaccination
but after you have the baby,
after 2 months. Yeah.
Okay. So, but if a mother is a carrier and she's pregnant,
you can't do anything to prevent the passage until after the baby is born.
So it's after the baby is born, that's when you test?
Well, you know, whether you test or not, you should do a vaccination. That's why hepatitis B vaccine is part of the childhood vaccination program.
Okay, so every pregnant woman should make sure she takes all the vaccination.
Yes.
Including hepatitis B vaccination.
Well, the hepatitis B vaccination will be for the child after the child is born, along with other childhood immunization. Okay, but it's part of it.
Shouldn't pregnant women vaccinate against hepatitis B?
There's no point because they're already...
There's no point.
There's no point, yes.
All right. Okay. I just wanted to clear that.
And so that's vaccination for newborns.
Okay.
Healthcare workers that are not infected should also be vaccinated because healthcare workers are high risk.
Okay.
Nurses and doctors.
Okay.
To an extent, pharmacists, but not pharmacists really don't come in touch with blood.
Nobody, the pharmacists in Nigeria, they do treatment in the pharmacies.
Well, the ones that do treatment and come in touch with blood should protect themselves.
Okay.
But normally they are not supposed to do that. Okay. So, yes, so healthcare workers are high risk. If they are negative, then they should vaccinate themselves. Okay. Now, for the rest of us, avoid contamination from body fluids.
Okay.
For a potential carrier, and it's passed by saliva, by blood, by semen, and by other body fluids. Okay, even if known to be passed by sweat. And so it's important to be aware of that and make sure you avoid such a...
Yeah, but in this part of the world where we live a communal life, you know, we eat together, we do everything together. How is that possible? Eating
together will not get you infected with hepatitis.
Because some people, you know, when you're eating, they just walk in and they take the spoon and they just start eating. Then they drop the spoon back for you to continue.
Potentially, there can be contamination. If you have a saw in your mouth, for example, and you use a spoon or a toothbrush, and somebody uses a toothbrush, yes, there's definitely a possibility of contamination.
But if there's no saw in the mouth, you cannot, when you eat together with the same cutlery set, it does not affect.
It's not likely. But when you kiss,
when you kiss and there's saw, what if there's no saw in the mouth and the kiss?
Well, it's also been shown to be passed by saliva.
Okay, saliva.
Yes, so it's also possible. So that's the husband and wife. And I know that these days, apart from HIV testing, people do hepatitis testing. Okay. They also check for their blood in case of sickle cell.
Okay. How often should you screen to know your status in case, you know, you're a carrier of the hepatitis?
I think at least once a year should be okay.
Once a year, okay. All right, so 28th of July is World Hepatitis Day, okay? And you're here to sensitize my viewers so that they can get information. Yeah. Are you planning any screening at Bola Pharmaceuticals?
Well, we're planning to do screening, and we are going to be partnering with some organizations. We are going to go to some hospitals. Okay. We are going to go to some private organizations and do screening within their premises. But we'll make the information available hopefully by next week to know the specific places. Okay. And we'll also make our phone number available so you can call us to let you know where the screening. We also probably do some screening within our offices also.
Okay, and of course, Health Monitor will be organizing screening as well to make sure that you get tested and you know your status if you are positive.
Inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah. It's Health Monitor, the #1 health show.